As a clinician, I spend a lot of time helping women to discern their internal experiences. And this comes up frequently as we explore whether, if how you're feeling is a natural response to your transition to motherhood, or if you developed a mental health condition. Let me explain the difference between the baby blues and the most common perinatal mood and anxiety disorders. Now, the baby blues refers to the uncomfortable feelings that you might experience directly after childbirth, and up until about 2 to 3 weeks postpartum. It's characterized by some mild mood variability, tearfulness, and irritability, similar to like PMS. It's said to be caused by the rapid hormonal shifts directly after childbirth, and about 80% of women will experience the baby blues. And they're not necessarily a mental health condition per se, because they naturally lift on their own and because they are so brief. I almost always suggest amping up your support from family, friends, and even some childbirth professionals like a postpartum doula or a lactation consultant to help with the baby care during this initial time in your recovery, as a strategy to not exacerbate any emotional symptoms you may be experiencing. But if you find that your baby blues don't naturally dissipate or they become more intense, then you should consider talking to a trusted loved one or a medical professional about how you're feeling. The simplest difference between the baby blues and postpartum depression is simply the duration and the intensity of your symptoms. Now, in postpartum depression, the primary cause is also said to be the enormous shift of reproductive hormones following delivery. But there are also many other potential risk factors that help to create this serious and the most common perinatal mood and anxiety disorder that affects about 1 in 5 women. These risk factors include things like a history of anxiety and depression, sleep deprivation, nutritional deficiencies, isolation, your family history, a lack of support, and that's just to name a few. Some common symptoms are low self-esteem, difficulty sleeping, even when the baby does, changes in your appetite, typically a decrease, anger, worry, loss of interest, low energy, excessive guilt, feeling overwhelmed, frequent crying, lack of emotion, hopelessness, and thoughts of harm to yourself or others. The next most common perinatal mood and anxiety disorder is postpartum anxiety. It's important to know that some amount of anxiety is common and necessary in the postpartum period when we need to be alert enough and aware of dangers in order to care for our young children. However, if it begins to interfere with your ability to enjoy and take care of your baby and yourself for 2 weeks or more with little to no relief, if you find that you're having more bad days than good, then again, consider talking to a trusted loved one or a medical professional to be screened for a perinatal mood and anxiety disorder. Anxiety can be tricky because it shows up in 3 different areas. It first can show up in your mind, and it can feel like racing thoughts about the future, imagining the worst case scenario, worrying and obsessing, and scary thoughts of harm. You can also experience anxiety in your body, and that can feel like nausea, upset stomach, tightness in your chest, dizziness, heart palpitations, a loss of appetite, and difficulty sleeping. And finally, anxiety can manifest itself in actions, such as avoiding certain situations and activities, places, or even people, trying to over-control, asking others for constant reassurance, checking things repeatedly, and being extra careful and vigilant of danger. The most common example that I see in my practice are women who come in who are concerned about their babies, that they may stop breathing in the middle of the night. And in their minds, it can show up like a constant worry, a thought and a fear that they can't seem to turn off. And in their bodies, it can feel like an upset stomach with frequent trips in and out of the restroom. And in their actions, it can mean for them checking the baby monitor repeatedly, so much so that it interferes with their inability to get consistent rest. Know that it's okay to not always be happy all the time during this transition to motherhood. I mean, you've just gone through one of the greatest transformations, or are preparing to, of your entire life. And more often than not, that comes along with some challenges. You might experience periods of high stress, sadness, and even ambivalence. But if you're feeling down, moody, or irritable for 2 weeks or more without relief, and it's a marked change from your norm, then consider talking with someone about how you're feeling. In addition to the postpartum care plan that I will share with you, I will also include copies of 2 screening tools that I use most often in my practice. Note that these are not necessarily diagnostic tools. That can only happen in the presence of a medical professional. But look at these tools and see if anything resonates with you. See if it gives you maybe some language to further discuss how you're feeling with a medical professional. And chances are, for mild to moderate symptoms, simply psychotherapy will be recommended. For moderate and severe symptoms, medication and psychotherapy may be recommended. But if you feel like you want to hurt yourself or someone else, bypass all of those steps and get help immediately. And you can do that by speaking with your OB, your midwife, or your doula, or check postpartum.net for a list of specialized practitioners in your area. One of the biggest challenges that I see with recognizing whether or not you have a perinatal mood and anxiety disorder is the fact that the symptoms, such as fatigue and trouble sleeping, often mimic the physical symptoms common in pregnancy and the postpartum period. I often suggest sharing the previously listed symptoms with a trusted loved one who may be able to hold a more objective view of your circumstances. This list, along with additional resources, will be made available in the postpartum care plan that I've specifically modified for you. But remember, beyond all of that, it's important to know that perinatal mood and anxiety disorders are 100% treatable, and the sooner you get help, the easier it will be to recover.